Urine is a waste product that is produced in the kidneys as they clean the blood. It is then collected in the bladder. Urine contains chemicals that your body does not need and can be harmful if it moves from the bladder back to the kidneys. It's important to empty the urine from the bladder regularly, 4 to 6 times a day as appropriate, depending on your fluid intake, diet, and medication. Take your time to ensure that the bladder is emptied completely each time you empty your bladder. If urine is retained in the bladder, it may cause an infection of the urinary tract. In this video, you will learn, step by step, how to empty your bladder. It's relatively simple, but will require some practice. Start by washing your hands thoroughly with soap and water. Remember to wash your thumbs. Make sure you have all the supplies ready before you begin catheterization. You will need a catheter of the appropriate size and a urine bag. You will also need soap with a neutral pH value, moist towelettes, a drape, and perhaps something to hold your clothing away from your body. On the back of the package, remove the round adhesive cover from the adhesive tab and attach the package to a clean surface. The pouch should hang vertically in an area that can be easily reached. Open the upper end of the package by pulling the ring towards you, and then downwards. To avoid spilling the liquid from the pouch, peel only until you see the entire colored funnel. Connect the urine bag to the colored funnel on the catheter and place the urine bag in a secure position. Arrange your clothes so that you can move freely when doing the catheterization. If you can, always try to urinate on your own before using your catheter. To prevent pushing bacteria into the urethra and bladder when you use the catheter, you must clean the head of your penis properly. Gently pull your foreskin back if needed. Wash the head of your penis in a circular motion, starting at the urethra and working outwards, to remove any bacteria that might be present at the opening of the urethra. Use each moist towelette only once. From this point, make sure that you keep holding your foreskin back and that you do not touch the head of your penis with your clothes. Remove the catheter from the pouch. The first 2 inches below the funnel are uncoated, so it's easier for you to hold. Make sure the catheter does not touch anything before you insert it into the urethra. If it comes into contact with surfaces, it should be discarded, and a new catheter must be used. Touching a sink, clothes, or skin, for example, will contaminate the catheter and could potentially cause infection. Hold your penis pointing upwards and towards your stomach. This will ease the insertion of the catheter as the natural S shape of the urethra is changed into a U shape. Provide a gentle pressure to the head of your penis in order to open up the urethra. But be careful not to squeeze your penis, as this may obstruct the passage of the catheter during insertion into the urethra. It's important that you relax to make the insertion of the catheter as easy as possible. Slowly and gently insert the catheter into your urethra. You may feel some resistance when the catheter is passing the prostate and the sphincter, so be gentle. Insert the catheter until it reaches your bladder and urine begins to flow. Then insert the catheter about 1 inch further and hold it there until urine stops flowing. When the urine stops, slowly begin to withdraw the catheter. If you use a regular catheter with a straight tip, it is recommended that you slowly rotate the catheter as you withdraw it, and stop each time more urine drains out. This is to ensure complete emptying of the bladder. You can dispose of your catheter and packaging in a trash container. Do not flush it down the toilet. If you used a drape, throw it away properly. Wash your hands again, and the process is now complete. Important note: the catheterization procedure must always be carried out under guidance from a healthcare professional. The instructions provided in this film are only intended as follow-up to advice you have already been given.